First off, we have Sinisha Krstov. Sinisha is a manager, access and engagement at the Australian Multicultural Community Services. He's a multilingual person and a fellow Macedonian with a strong educational background in conflict resolution, social science, and community services. His passion lies in innovation and technology, and he wants to deliver high standards to empower the culturally and linguistically diverse communities and individuals to maximize their potential, and is always there to help his community. Sinisha, welcome, and thank you for being with us today.
Thank you, Liliana, for that nice introduction, and thank you, Nikki, and the Centre for Cultural Diversity in Ageing for inviting me to speak today in regards to the Specialised Support Services program in particular. I have over 10 years experience in supporting culturally and linguistically diverse community to access services and navigate the service system. My focus today will be on the Specialised Support program as part of the Commonwealth Home Support program, which was before the Home and Community Care transition to the Commonwealth Home Support program in Victoria, known as the Access and Support program. Before we do that, I would like to share some of the barriers when in accessing services that culturally and linguistically diverse people are facing. And in this particular slide, I have divided them in 4 categories. The first group of barriers is language-related barriers, where people have minimum or no English. They require language-specific support. They experience lack of knowledge how to use and request interpreters, and so on. Cultural barriers relate to the person's culture, values, tradition, and norms, religion in some instances as well, and they all need to be considered in order to provide culturally and linguistically appropriate care to people. Health-related barriers may include mental health, hearing impairment, chronic health conditions, dementia, incontinence, anxiety, depression, and so on. And some other barriers that I came across throughout my work is lack of knowledge regarding services available, social isolation, no support networks in place, lack of trust, lack of confidence communicating with authorities, and so on. So what we need to consider when we are assisting people from culturally and linguistically diverse background. First of all, we need to be able to reflect and identify our own biases and preconceptions. Conduct research about other people and their cultures, who they are, what diversity means to them, what is their migration journey, if any. So get to know people, community leaders and colleagues from other cultural backgrounds, and ask a question about their culture, what's specific to them, for example, and what are their life experiences. Try to identify solutions that make you uncomfortable when you work to alter your behavior as a professional. Ask for feedback from people on how you're interacting with them, and increase your awareness of body language as well. We need to also get organizations and management on board as well in order to provide the right support for cultural, diverse, and linguistically diverse people. So how can we do this? Of course, by initiating activities and action policies and procedures that commit their organization to support and appreciate cultural diversity and inclusiveness. Organizations must ensure the laws relating to human rights, equal employment opportunities, prevention of any type of discrimination, and social justice are understood and complied with by all staff members within your respective organizations. Managers should contribute to the development of policies and procedures and act as role models in ensuring that their workplace is accepting of others and inclusive. After all that, we can now focus on the Specialised Support Program, or previously known in Victoria as the Access and Support Program. This is probably the most difficult thing to explain, especially to people from interstate. Victorian professionals working in the industry will understand it better. But I wanted to have this slide to make a note of the fact that supporting diverse people to access services and navigate services was present in Victoria with the introduction of the Access and Support Program approximately 12 to 13 years ago. When the Home and Community Care Access and Support Program transitioned to the Commonwealth Home Support Program, the Commonwealth continued to look after people who are 65 plus and help them to access services and navigate the service system through the Specialised Support Program. So practically the Access and Support Program for people over 65 became the Specialised Support Program. We'll talk a little bit more about this to unwrap some of the details in regards to it. Before we do that, we need to understand what is available and out there in terms of navigation programs and initiatives that are supporting culturally diverse seniors to access aged care services and support. As most of you will be aware, we have the aged care specialist offices. This is a service set at Services Australia centres, some, and an aged care specialist officers is part of the My Aged Care face-to-face services, and they can offer people at Centrelink or Services Australia centres to access services and deal with aged care related matters. We have the Specialised Support Services that can help, beside other things, to help people with advocacy and culturally and linguistically diverse advisory services. We have the care finders, and we have some ethno-specific and multicultural service providers that can offer some cultural and linguistically diverse advisory services, and some local and time-limited projects across our nation. And some organizations have their own self-initiatives to provide support to this particular cohort. So the Specialised Support Services, or SSS in particular, is a type of service that refers to the specialised services for frail older people who are living at home with a chronic condition or a special need. Services are entry-level and are intended to complement other CHSP services. These services are targeted primarily at supporting the individual, and services must help clients and their carers and families to access episodic support and information to manage these conditions and maximize clients' independence so they're enabled to remain living as long as possible in the comfort of their own homes. This particular service can provide a holistic and integrated approach for people with diverse and individualized needs, comprising a mix of advisory, targeted support, and tailored advice. Services are not intended to subsidize primary health services or allied health services available through the healthcare system or other Commonwealth Home Support Program service types. So some of the services incorporated in this particular program can include assisting people to develop plans and strategies to manage their conditions, conducting timely evaluations and monitoring the progress towards the goals that you will set together with the client, their carers, and people involved in their care, establishing client-centered goals, providing advocacy, education, and the right advice, supporting capacity building sessions for those in a clinical conditions or have a specialized needs, incorporating elements of prevention and risk reduction. Some examples of specific specialized services include, but are not limited to, continence advisory services, dementia advisory services, vision services, hearing services, services for other clinical conditions, and what we're here to talk about today, the client advocacy segment, advisory and support services for diverse groups in aged care. In my personal experience, very often clients are facing a group of these barriers, so multiple conditions and multiple service subtypes as listed here. So a combination of dementia with some continence advisory services, vision and hearing services, other chronic health conditions that people are trying to manage on top of the need for client advocacy and advisory services is something that we see on ongoing basis every day throughout our work. What does in particular the advisory and support services as part of the specialized support program means? Advisory and support services, or known as client advocacy, is now referred to it as advisory and support services as part of this program. It may include services for older people who have a clinical conditions and identify with one or more of the diverse groups in aged care. Advisory and support services target clients and their families who can proactively access aged care services, but without needing intensive or one-on-one support. The service includes, as I've mentioned before, capacity building, supports to help the client and their carers and people involved in their care to maintain their independence and build skills to better manage their clinical condition and understand individual needs when accessing aged care services. Linking support to help clients access my aged care and other services may be part of this particular service as well. So when Selen in the next presentation mentions the care finders, there will be similarities in the support we offer. However, we work together with other professionals, including health professionals, including service system navigation professionals, to completely and fully meet the client care needs in regards to access, engagement, support, and ensuring that they're well looked after. So what I can give as a final advice is that when you work with culturally and linguistically diverse clients, it's very important to know who they are. It's very important to get to know them, know their migration journey, and this will build on something that we call trust. If a trust is established, people will be happy for you to support them and help them reach their goals. And in my experience, I haven't met even one client that doesn't want to stay in the comfort of their own home for as long as that's possible and safe for them. So continue helping people to do that. It's a mission for me, and it's a mission for all of us. Thank you for your time.
Now we have Selen Akinci. Selen is a diversity and inclusion strategist, strategic partnership manager at the Multicultural Communities Council of Illawarra, or known as MCCI. She has over 7 years experience in community development, advocacy, capacity building, and culturally appropriate service delivery in aged care. She has come from Turkey, so she's migrated from Turkey in 2009, and she started working as a social worker with family community services and as a behavior support clinician with an NGO. Her interest prompted her to move into community aged care. She is now with the Community Council of Illawarra, and we are so pleased to have her here. She's also part of the PCAC program. So, Selen, we look forward to your presentation.
Hi, everyone. And then I was just seeing that lots of the care finders here. I'm not alone today, so which is good. As the Biljana mentioned, so I'm working at the Multicultural Communities Council of Illawarra, and so we funded by PHN, the coordinator for the 3 years the trial to support the older individuals coming from the culturally and linguistically diverse background. We're helping the individuals, vulnerable people, trying to help them to navigate the aged care system, to finding the right service. I know like the system, the gaps and then the barriers is there, but like we are trying to help the individuals and then trying to find the right services. And if they are not happy with their services, we are helping them to change their services. So what we are doing is like for others like who doesn't heard about the Care Finder program, and then what we are doing is like providing the free information to vulnerable, the older adults. We are assisting them for applying any of the aged care or the other the services in their local areas. And who we are helping is the vulnerable individuals, like who doesn't any the family support, or maybe their family is like around, but they are not able to help them. So and then this is the who are in need in the intensive support. So how we are doing it, like I'm going to talk about during my presentation. So our approach actually is like how we are trying to be, as I mentioned. So we are helping the individuals coming from the culturally and linguistic diverse background. And then today I'm just going to talk about a little bit like our approach, like how we are working with the multicultural communities. So and then while we are doing that, like we are using the assertive approach a lot. So which is like we are connecting individuals with their, the safe environment. And then they we meet them with their preferred locations, and we are doing the need assessment, the initial assessment, understanding their needs. And then after that, we are kind of walking with individuals through their journey to find the right services. The type of the complexities the care finders are going through. This is from my team. I have 4 care finders. They are real experts, and I'm just representing them today here. We have lots of the complex issues. So we are dealing with lots of tough situations. Like some of them are they're facing with homelessness. Like for example, only in local areas, when we are looking at the numbers, since 2022, so 55% of the increase in the homelessness, for example, and then 60% of them are coming, and then 55% is actually is over 65, and then 60% is just elderly women. So, and we are dealing with the hoarding and squalor, which makes the individual's life really hard. We are and especially someone is they're not able to speak English, the communication, they're getting the more difficult. So we are facing with the family problems, domestic violence. And then lots of the paperwork, and then someone is coming from the refugee background, someone doesn't have any, the eligibility, so coming from the premature aging and everything. So I'm sure all the care finders, they're facing the similar issues. Even this is the little, the regional area in Illawarra, but I assume so we are facing these complexities as care finders nationally. So the first one is Maria. Maria is 86 years old, coming from the refugee background. She doesn't have any the family support, and then she has a very few friends. So she's been living in Australia actually for a while. This is her the 40 years. But when she came to care finders, she was facing with the evictions from her place, and then there were the risk of homelessness. So, and then you can imagine she can speak English, but in the certain points, when they're applying there's some certain services, or when she get anxious, her English level is just a little bit changing as well. And then definitely she has a poor digital skills while we are helping her. So she developed aggressive cancer as well. This is the second case scenario. I know it's the same, the photo. So I just didn't want to story type. So I just wanted to use the same photo because of that. The Cora is Italian background, 88 years old. So caring the partner, so who is living with the dementia. And then she has 3 sons actually, but she's not seeing them. And then one of them coming with lots of the complex, the mental health difficulties, and then substance use. And then we found that her son moved back home. They were AVO, but moved back. So, and then the incidents involving him were occurring regularly to home, and then all the services stopped because he was regularly breaching the AVO so many times. So in the end, he was arrested. After that, he just released and then came. And then there are lots of the psychological stress as well. So, and then as you can see, there are the big issue because all services stop. And then it's this case is still continuing, to be honest. So with all those cases, what is our approach, like what we are doing? So we all talking about the person-centered approach. I think that we all know like what is the person-centered approach, like understanding the unique needs, understanding the individuals and then their perspectives and then their history and everything. So but when we are talking about the working with the multicultural communities in the context of the CALD communities, like we are looking the universal dimensions, like for all individuals, like we have the certain needs, like we need a shelter, we need the food, we need safe environment. But when we are looking for the cultural dimensions, like when we are working with the individuals, like we are understanding their history. So for example, like with the Maria's case, like she was coming from the refugee background. So like how many years, like for example, like did she live in the detention center? Like how many years like she lived there? So like what kind of, the cultural norms and then beliefs and then values that she's bringing in. So we are looking all those details like when we are like working with the individuals. So they're coming from the refugee background, and then all those, like the stresses and then psychological issues. So like we are helping them, so with the empathy. So, but when we are looking for the individual dimensions, so when we are saying that this person is like unique from the others, like, yes, so she's coming from the certain refugee background, like her age and everything, how all those experiences shaped her behavior, so like how they shape her fabric. So and then like we are understanding individually her. So and then empowering her during while we are supporting. And the culturally responsive practice. So culturally responsive practice in support, the services recognize the unique invisible suitcases from the each individuals. So this is the field from the norms, the values, experiences, and then their personal histories. So this practice is important because when assisting individuals coming from the multicultural background, so it respects their cultural identities and acknowledge their diversity in their diversity. So, and then like we are looking like all on suitcase, like when we are like working with these individuals, like for example, like we are bringing some norms and the values, like as a care finders, and like we have some our own cultural identity. So even like we are Australian or coming from the different cultures. And we do some assumptions and biases, definitely we do. So it's like as a human beings, like we are doing it, I think is the most important thing. So we are reminding, or we are mindful about like that we have assumptions about the individuals cultures or like people. We have a power and privilege. I think this is a very important thing as care finders. Like we need to remember, because like like we are holding the certain informations. Maybe individuals are not able to aware of it. So we have kind of power to make these changes for their life. Like for example, with the Cora's situation, so we had to call the police, but we just didn't just call the police and then yes, like he's breaching the AVO and then police needs to come and everything. So we just really work with Cora during that situation because like her age and then like as a Italian, the cultures and the family centered, and then not just only the Italian, the background, but her like individual, the family structures, like she was pretty much attached to her son as well. So it wasn't an easy process. So, and as care finders, like we showed some privilege to individuals. And then like we are remembering that one, even just someone is coming from the migrant background or refugee background. And cultural intelligence, probably you've been hearing that, is very essential for care finders in the case management, especially like when we are working with all the diverse the communities and then with this the complex situation. So what I'm trying to say with the cultural intelligence is being able to tune the individuals' histories, their values, beliefs. You just feel like I'm just repeating all those things, but this is it. So, and then, for example, like when we are speaking with them, their body language, and then asking questions on, like we are asking the questions when we are taking the cases. What is my motivation? So what drives me, and what knowledge I need to know, and what is the plan? So like, for example, as care finders, they show the genuine interest, like with the Maria situation. So 86 years old, and then she's been living in the same place like for more than 30 years, and then like a risk of homelessness, and then like her cancer just arose during that time. So we really, our motivation was wanted to genuinely help her, and then to build a relationship and then trust between us. So and then knowledge. So like we knew the certain information about that coming like from the refugee background, but at the same time, like she was pretty much vulnerable and isolated. Like she didn't have too many friends, or the family. So just a few friends. And then she had certain connections with her pharmacy and then GP. So when we are doing our plan, like we just really wanted to make sure. So like we find some accommodation, affordable housing around that area that she can access, like her pharmacy and then GP and everything. And then with all knowledge, yes, like we just did all the research a little bit, but at the same time, like we are asking the individuals, like what their interests, how they are, who they are, or we are asking, like we are seeking information from the community leaders, like who support them before. And like the belief is that they are pretty much happy to share. It's like when you are genuinely like asking and then being, wanted to understand the individuals. So, and then all strategies, yes, like, we just help Maria through the complex housing system. So taking into account like her fear of homelessness, the poor digital skill literacy, and then lack of, connection with the community, but strategies are always changing. So like it's changing from unique person to unique person. So because of that, like holistic approach is very important. Like we are working collaboratively with the other organizations and then services. Enablement approach is very important as well, because trying to remove all barriers, with individuals, like as a care finder, like for example, like with Maria, she didn't even have a mobile phone, like it's like even nothing. So she had a home phone. So and then like any form, she didn't know like how to engage like the My Aged Care and everything. So this is the cultural intelligence. As care finders, assertive outreach, as I mentioned before, the building a trust is very important. The person-centered approach. So, like understanding their individual dimensions and the cultural, the background, and also like even if someone is coming from the refugee background or the low literacy or the English and education, so it doesn't matter. So we are just trying to involve them in the decision-making process, and then like be aware of their the trauma, and then try not to, to create interactions and to be sensitive their traumatic experiences, and then try not to be re-traumatize them. So because of that, the building trust and then taking time is very important. So, and then the flexibility, of course, and friends, families, and then bilingual, which we are all bilingual, and then yes, like we are all using our skills, and then like of course, like we are getting support sometimes from the families and friends while we are, like during the advocacy role, but this should be acknowledged and then valued and understood, of course. But like we are like working with the interpreters are very, very important. So like we are involving the interpreters in our approach most of the time. Government has a free translation services, and then we are pretty much using it. Like recently we translated one of our guide is the guide is just included all the free government funded organizations, and then giving a little bit the information, and we translated into 17 languages, and then we are sharing with with all the first initial assessment, for example, the need assessment. So we are getting the certain languages with them. This is a very important as well. Like we are very lucky in Illawarra, so we have the contract manager, Claire Bishop. So, and then she did like kind of establish a great committee of the practice group here. So like we are regularly meeting with the other care finders in all regional area. So we are receiving the different trainings, and also we are doing lots of the reflection, reflective, the sessions. Like we are sharing all the case studies, like we are sharing, so we're, like the best practices as well. Like we are learning from each other. And then also as care finders internal, like we are meeting regularly and then doing the brainstorming, and then what we can do better. So what we have, what we achieved, what we couldn't do, what we could do differently. Again, as I mentioned, this strategy didn't work, so what we could do next time, so differently. So we are like regularly discussing. This is the last slide. So in case management care finders, please like give your time to build the trust and rapport with individuals, and then implement a holistic approach, collaborate with the other the service providers. And I know there are lots of barriers, like systemic barriers we are facing as well, but please don't give up, and then be persistent with your advocacy, and then please don't stereotype the individuals as well.
I believe the best thing to do, if you don't know who the care finders in your local areas are, to reach out to the local primary health network, and they will be able to advise what organizations are funded to deliver this particular service. So reaching out to the primary health network, it's something that you can do. In regards to the Specialized Support Services program, you can use the My Aged Care Service Finder to find local specialized support service funded organization as well. And in regards to the eligibility criteria will be the same like any other Commonwealth Home Support Program funded program. For specialized support, people will have to be 65 years old or older in need of care and support services. In regards to the people under 65 in Victoria, they can access navigation and supported access support via the State Access and Support Program. And you can do that by contacting your local home and community care or HAC access and support provider. When we're talking about the home care package program, the expectation is if someone is accessing a home care package, that they access a full set of services and everything that represents a care need for that particular client on a home care package, including relevant support alongside mental health, dealing with mental health issues. It will be a responsibility of the particular and appointed care advisor for that particular client to respond to those care needs and organize the services for that client.
When you're looking at the complexities and then what we are doing as care finders, like we are pretty much doing really case management work here. So Dina, I think it's like, don't give up. Like in the end, I say like I know like the reality is that the people are waiting. So, like all waiting lists, the days and then hours has changed, but we're just going to continue to advocate and then try to help.
The question that I get all the time from clients, from carers, as well as other professionals working in the industry as well. So the Commonwealth Home Support Program manual is clear that there's no residency status requirement to access home care services. So people on various visas are able to access My Aged Care and assessment as well. They may be asked to pay full cost recovery, but there's no restriction in terms of residency status to access Commonwealth Home Support Program funded services.